Okay, let's talk about arthritis of the hand, or just arthritis in general. You can say we see quite a bit of that too.
Sure. So when people talk about arthritis, what they're typically talking about is osteoarthritis. And what osteoarthritis is wear and tear of the joints. So joints have cartilage on the end of bones. So a joint is where two bones meet and there's cartilage on the end of those bones. And what osteoarthritis is wear and tear of that cartilage, which provides the smooth gliding of joints. And as it wears out, it generates pain and difficulty gliding. And so I tell people that osteoarthritis is a part of the natural aging process. So it's essentially like graying of the hair. Everybody starts wearing their joints out at some point in adulthood, and people wear joints out at different time periods and at different times in their lives. There's some people that see it earlier in life and some people that see it later in life. Would you say that's accurate, and what types of arthritis do we typically see in the hands?
Yeah, that's completely accurate. It's a life-acquired problem. We see quite a bit. I think that's the most common. Probably next most common we see is what we call post-traumatic arthritis. You may break a bone in a joint, and then with years and time, due to the irregularity of that surface, it's exactly what you said, the cartilage is going to wear like osteoarthritis, but it's going to wear faster. And so you're going to come in with what we call post-traumatic, and we essentially treat that the same. And then you have your other types of arthritis, which we see but don't see as commonly, like the inflammatory arthritis. What's your thoughts on those?
That's right. So sometimes when people are talking about arthritis, they're talking about rheumatoid arthritis or psoriatic arthritis, and that's a different type of arthritis that we label as inflammatory arthropathies. And the reason that that's different is because those are conditions where your body starts to attack its joints. And they're called autoimmune, which means essentially your body is attacking the joint. And the way that those progress and also the way that they look in the hand is very different. Would you like to talk about some of the differences?
Yeah, a lot of times it comes in with an isolated joint, so like maybe one finger, where osteoarthritis typically will involve multiple, and then sometimes it's very swollen and can be very painful also. I think one of the key reasons to figure the differential out is sometimes those can be treated with medication versus surgery or versus injections. So what's your thought when you see somebody who you think may have inflammatory arthritis? What's your next steps?
So if we see something that we think is inflammatory arthritis, like lupus, rheumatoid arthritis, psoriatic arthritis, a lot of times we'll do two things. One is get a panel of blood. So there's some blood tests that can indicate you're at increased risk or you may have one of those problems. And also involve rheumatologists, who are the physicians who are specialized in treating those specific types of arthritis. So circling back to osteoarthritis, one of the most common questions I get in the office is, how do I prevent arthritis of my hands? I'm starting to get pain, I'm starting to get stiffness in the morning, and I'm starting to get these nodules on the back of my knuckles. So how do I prevent the progression?
Yes, very common question, and my answer to that is unfortunately we cannot if it's osteoarthritis, because people also ask you may see the fingers start to deform. How do I prevent the curling of my fingers? So my comment to that is unfortunately we cannot. We can help with the symptoms as they progress. The things we can do in those times are mobility. We think mobility in arthritic joints is actually good. It can help the pain. And then there's also different treatments like paraffin wax, heat treatments, topical creams, and then as the symptoms progress, as you know, more interventional things. So what's your thoughts on someone who comes in with a arthritic hand that has affected their function and quality of life?
Mm-hmm. That's exactly right, and I tell patients the same thing, is the motion of the hands is so important. So some of the things we start with, anti-inflammatories, Tylenol, and therapy. And then if they come in, I have the discussion with them, are there any specific joints that bother them? And when I say bother them, kind of my criteria for bothersome arthritis is, does it ache all the time? Does it keep you awake at night? Or does it make you miserable? And if there's one specific joint that meets those criteria, then we have the options of treating it a little more invasively with things such as steroid injections and surgery. Is that kind of how you approach it? Is there anything to add?
No, I approach it exactly the same way, and I really let the patient let us know how it's bothering them, because ultimately it's their decision of what they want to do, as you know. And if it's not a big, what we'd call effect on their life, then we say let's monitor it for a while. But when it becomes a functional problem, more intervention is reasonable.
Mm-hmm. And one of the questions I get a lot of times, if we tend to treat it symptomatically without surgery and injections, is this going to progress beyond the point of repair, or am I going to do permanent damage that you can't fix? And what do you tell people about that?
That's a great question. I think I tell them, for the most part, and it is specific for different body parts, or even different parts of the hand, but I tell them that typically they can wait until it really bothers them. There's not really a good reason to be proactive and get the surgery done before it gets too bad. That's what we tell them.
Yeah, and I tell people the same thing. It's just wait until it bothers you bad enough, and oftentimes it's kind of cliche in surgery, but a lot of times we'll say, you'll know when it's time. You'll know when it's time to have surgery. You'll know when it affects you enough, and you tell us when it's time to have it fixed.